Assalamu alaikum, yakan abdu yakan astain. So in today's video I'm gonna go through the medicine 23rd May morning paper. So let's start. The question number 1: the couple came back from Egypt, developed sore throat, yellow sputum with the nausea, abdominal pain and the diarrhea. Which drug you will give for the causative agent, that is clarithromycin? An old man came from the Thailand having swear, restless, having scrotal pain, discharges, swelling, also the history of sexual activities. What will be the treatment option? Cipro 500 mg per oral with azithromycin 1 gram OD. When botulinum a toxin is used for the blepharospasm and the orofacial dyskinesis, what's the mechanism of botulinum? That is decreased release of acetylcholine from the presynaptic neuromuscular junctions. The lateral corticospinal tract is functionally related to the rubrospinal tract. Next, the depletion of the serotonin and the noradrenaline will cause increased duration of the REM sleep. The pathogenesis behind the hereditary mole is abnormal trophoblastic proliferation. The patient with history of the some type of the cancer, hemicolectomy done, having Duke's type B stage. You will follow up the case with the help of the carcinoembryonic antigen. The person with the blood group A will have the anti-B antiglobulin on erythrocytes membrane. The patient have the lipoma on the posterior aspect of SCM, 5 cm relation to the sternoclavicular joint, which structure ligated leading to the profuse bleeding, that is the second part of subclavian. Young lady with the breast cancer having the history of 2 sisters suffering from the ovarian cancer, which gene mutation is responsible for the BRCA1. The lady is counsel for the amniocentesis for the analysis of the some chromosome abnormality in her child. The procedure cannot be done before the 10th week. The private sector hospital catheter is more than 60% person in a severe dehydrated state. What percentage of water will be absorbed at the PCT? That is the 60 to 65%. During the thoracic surgical procedure, the surgeon should care the structure while ligating the internal thoracic artery. The structure likely is the ipsilateral phrenic nerve. The neonate is brought by his mother with the complaint of the cessation of breath on and off, and the blue discoloration of the skin, examination, decreased chest movement on the left side, and auscultation of breath sounds on the left side. On X-ray, bowel loops are seen. There is the congenital diaphragmatic hernia. Next, the neonate is brought by the mother with the complaint of the cessation of the breathing and on and off, blue discoloration of skin, examination, decreased chest movements on the left side. This is the same scenario. Patent on X-ray loops, bowel loops are seen. There is the patent pleuroperineal canal. The lady had the difficult labor at the home, the village. She was brought to the hospital. History of the PV bleed oozing from the gums for the last 10 hours. CBC shows the 6 uh, CBC shows 6 gram/TLs, platelets 30K, and TLC 24,000 neutrophilia. The peripheral blood film shows the Bursel's PT and APT were prolonged. The most likely cause will be the DIC. The lady had the difficult labor in the village. This is again same scenario. Which of the following interleukin will cause increase of the red blood cells from the T lymphocytes? That is the interleukin 3. After vagal stimulation, the heart rate slows down. Permeability of the SA node increased for the potassium. After vagal stimulation of heart rate slows down due to the permeability of the SA node for the sodium and the potassium. Next, the patient is being prepared for the tonsillectomy. Which of the following test must be done? That is the PTFG coagulation profile. The young boy hit by the ball on the temporal region. Swelling on the temporal region occurs on X-ray. The linear fracture of the parietal bone is seen, which is the cause of the swelling. That is the rupture of the middle meningeal artery. Max aortic pressure in which phase of the cardiac cycle? That is the rapid ejection phase. Next, the around 60% ventricles filling occur in the rapid filling phase. The nasal boils are usually caused by the Staph aureus. The person is unable to lower his eyes. The lesion is in the midbrain. Next, the eyes of the person cannot rotate from the adducted position. Which muscle is damaged? That is the lateral rectus. The lady suffering from the severe breast undergo mastectomy develop edema of the right limb. The following can be the reason of this edema. That is lymphatic obstruction. Young boy, the proteinuria 3.5 grams/dl and the whole body swelling. The cause of edema is hypoalbuminemia. The old man with the generalized body edema, the cause is the hypoproteinemia. The patient presents with the massive thromboembolism. What's the site of its origin? That is the popliteal veins. Next, 33, the female with the intraductal breast carcinoma. All features suggestive of the intraductal cancer with the peripheral dysplasia. What's the dysplasia? There is a non-neoplastic proliferation of the fibrous connective tissue. Normal AA ratio should be more than the 0.75. The antibodies are produced by the mast cells. What's the percentage of IgA? There is 70% drug used for the motion sickness is the promethazine. The student came with the pale nasal mucosa, nasal congestion and sneezing. He is having these symptoms since 3 months. On examination, inflamed edematous nasal mucosa seen, which among them will be effective now, that is the intranasal corticosteroid. The sexually active female came with the dysuria, urine dipstick, and the culture shows increased leukocytes, positive nitrates, and the gram-positive organisms, that is Staphylococcus saprophyticus. The patient present the Crohn's disease. The treatment of the remission corticosteroid is given, what is the best for maintenance of remission of the disease, that is azathioprine. The soldier at the high altitude experiences hypothermia on the returning to base camp, adapts to the cold weather by the heat generation due to which of the following is the hypothalamus. Next, the patient with the history of the chronic cough and the fever, retronodular pasties and x-rays, epitheliite cells seen on the histology. What type of the reaction is seen there? The type 4 HSR. The pathogenesis of HIV AIDS, what is affected, that is the CD4 helper T cells. HIV most common fungal infection is the aspergillus. The patient presents with the hypoglycemia and hepatomegaly, having 3 canapes of the fainting, improved consciousness on the feeding. He is having increased lactate level in the ketones. The glycogen storage disease known as the von Gich disease is diagnosed, which enzyme is deficient in the patient. This is a glucose 6 phosphatase. 85-year-old patient presents to the clinic, fever and the neck stiffness. He had then splenectomy 20 years back. The causative agent would be in this case, that is the strep pneumonia. Most common organism responsible for the causing infection in the post splenectomy in a 4-year-old child would be the strep pneumonia. Here is a cycle. This is very important. Strep pneumonia, H influenza, and the Neisseria meningitis. The IgE receptors are present on which blood cell? The mast cells. What is the characteristic of the mycobacteria leprae? That is the acid fast intracellular bacteria. An aged man known case of hypertension was on the clonidine, run short of it. No presence with increased BP 190 by 110. With the no symptom. What step should be taken? There is the restart clonidine and again check BP after 12 to 24 hours. The lady presence of the trauma and the lift on examination, loss of the dorsal sensation of the left foot, the loss of dorsiflexion, the loss of version of the talodorsal joint, which is the falling nerve, is damaged here. That is basically the common peroneal nerve. Next is the hypocalcemia. Now what will increase the 24/5 dihydroxycholecalciferol. Next, which is the following metabolites of vitamin D is used for the laboratory assessment, that is the 24-hydroxylase. RT visualize the inferior thyroid gland is the branch of thyrocervical trunk. Husband and wife came to regarding the concern that they both are thalassemia carriers and they worry about the prenatal monitoring is necessary in this case because the child will be thalassemic. Next, the man penis with the parietal lobe atrophy, presence with the parietal lobe atrophy, what will be seen, that is the right lobe disorientation. Each of the man with the relaxed mind and eyes closed shows which EEG waveform, that is the alpha rhythm. The person in a marathon race, at the end of the race he drinks water to compensate for loss of sweating. What will be seen in him at the end of the marathon, that is the degrees I see a volume. 60-year-old man present the OPT of the combination of hematuria and unification of the DRE, that is a stony hard mass felt, that is the prostate lymphatic drainage of it, that is the internal iliac and the sacral. Most common C in the men worldwide is the prostatic carcinoma. The patient with the follicular thyroid carcinoma, it will mainly metastasize to the lungs. Next, the stab wound injury on the right side lateral to the sternum at the 6th postcochlear, what structure will be damaged at the right atrium. The 25-year-old male with the swelling in the left inguinal region, the positive cough impulse, it moves with the ipsilateral testes, is detected downward, it is painful. This is likely the inguinal hernia. The piano player presence with the right or left hemisphere and weight of the falling will be the problematic in him, that is the fine movements of the hands. Next, the cimetidine is given preoperatively as decrease the gastric acid volume, which is the falling antipsychotic drugs cause the hallucinations. Late mania, that is olanzapine. If the pyloric sphincter is cut, what will happen? That is increased gastric emptying. The denervation of the kidneys will cause the increased urine flow. The patient presents with the pain, the lumbar region stone at the polyureteric junction, pain arising from which of these segment, that is the T12L2. The patient presents the RHC pain. Dermatome for the cholecystitis include the T7 to 9. The aldosterone act on which part of the kidneys, that is the cortical collecting tubules. The patient presents with anuria immediately after severe episodes of the diarrhea and the vomiting. The creatinine 9.1 after 3 sessions dialysis, patient failed to have the urine output. Renal biopsy shows the cortical necrosis in the severe acute tubular necrosis, which is the cause in this patient. Irreversible injury. The female, the short stature, hand swollen, the neck widely spaced, nipple, and now 20 years of age with amenorrhea and absent secondary sexual characteristics. The likely karyotype of the diagnosis would be the 45 axonal low. Oxygen saturation at the sea level in a young adult is the 97%. The patient with the obstructive jaundice, what is the region with increased bleeding tendency, the liver unable to inside the prothrombin. The cytoplasmic anti-neutrophilic antibodies are seen in the vasculitis. The female with the dry eyes, dry mouth, having dysphagia, bilateral parotid swelling on the X-rays, pneumonitis. What is the likely cause? That is the primary systemic sclerosis. 35 to female with this 6-month history of the fingers turning cold. Raynaud's phenomena. Dyspnea novis. Large spleen, creatinine was high, urea reagent positive, HB10, TLC, and the platelets normal. The diagnosis is the progressive systemic sclerosis. 77 of the following vitamin is given along with the isoniazid, that is definitely the vitamin B6. Anti-TB drug dose is adjusted when GFR is below 30, that is rifampicin. The patient with the left atrial hypertrophy, increased pulmonary artery pressure in the lower S1, mild systolic murmur. What's the diagnosis? The mitral stenosis, the congenital erythropoietic porphyria, which enzyme will be deficient? Uroporphyrinogen 3, the boy with the history of the sickle cell anemia, having the fever, HP 4.5, deeply jaundiced platelets. These in the TLC 10,000 aspirin is palpable. Diagnosis would be the hemolytic crisis. The RTA GFR decrease in the patient's came with excessive bleeding caused the decreased GFR would decrease arterial blood flow. The best way to estimate GFR is by the creatinine. The patient in non-case of HBV have cirrhosis. Most common cause of the secondary hyperaldosteronism would be the renin, the lamella forming air blood barrier, or the type 1 pneumocystis. The right lung has the bronchogenic carcinoma. Middle lobe removed surgically. Segments include that is the medial and the lateral. The intercostobranchial arteries arise from the posterior vein of the descending thoracic aorta. During prolonged surgery of nators, the temperature of the patient is monitored by the probe in the esophagus. The nerve is cut distal to the head of the radius bone, result in the loss of the extension at the metacarpophalangeal joint and the loss of abduction of thumb with the no sensation loss. Which nerve is damaged? The branch of the radial nerve. The initiation of REM sleep is by the reticular formation. The most characteristic of the REM sleep is that is the benzodiazepine decrease interval of it. Lung root cut median to the branching of the primary bronchus. How can you identify the side of the root in the right and left bronchus? The position of the pulmonary veins. The shortest proerythrocytic phase is the plasmodium falciparum. Next, the capsule of the beta anthrax. The anthrax is stand with the amphiene stand. The 53-year-old patient had the non-productive cough for the 2 months. Non-smoker, no presented with the blood stick sputum. Left lung has the 5-center hilar mass. Sputum shows the hypochromatic pleomorphic cells with the scanty cytoplasm. Cause of this condition is the radon exposure. The patient presented with the hydrocephalus with the dilated ventricle to the case of blood cells. A barrier is formed the endothelium. Glial fibrillary acid protein positive in the astrocytoma. The characteristic feature to identify the sarcoma is increased viscosity. The cytokeratin is an intermediate filament found in the cells but is most commonly used for the detection of the identification of the neoplasia confirmed to be carcinoma. In obese patients, wears a tight collar shirt and the feels tiredness in the collar and the faint whenever he turns his head. Which of the following is responsible for this? That increased venous compliance after RTA. Massive blood loss. Patient undergoes shock. BP 80 by 60. What will activate now the baroreceptor reflex mechanism? The patient's finger cut. Doctor told him not to worry. What will find the regeneration by the stratum basale in acute response of the neurogenic trauma? What will release? There is a cortisol. The boy on the bicycle has an accident and presented with unable to ride since 2 days due to the injury of the urethra. Child is only the fast food present the pale lethargy with HB 8.5 MCV. This one, that is definitely the folic acid deficiency. The patient has anemia and the hypersecondary neutrophils. That is the folic acid deficiency anemia. The heterospherocytosis defective protein is which of the following? There is a spectrum during pharyngeal phase of the swelling. What is true? There is the larynx moves upward and the forward. The group of the disease person is compared to the not disease person to see association with the factor. Whatever the study is this, that is the case control study. Which of the following secretions are happening having more bicarb and the decrease after vagotomy? That is the pancreatic secretions. Insulin causes the glucose uptake in the skeletal muscles and fat tissues by the GLUT4. Neutropenic hypertensive patient admitted to the oncology ward with a history of the dysuria and the high-grade fever. His blood culture yielded growth of the pseudomonas originalis. The findings suggest that the disease is a result of the excessive release of the following product: the TNF. The function of C3A and the C5A is the increased vascular permeability in the anaphylactoxin. The former presented with the migrating gene lean on the foot. The executing larva migrant. The weightlifter was lifting weight in a competition. Suddenly his arms gave up and he dropped the weight. What is responsible for that? That is the Golgi tendon organs. Next, the patient in the shock because pulseless surgeon palpate between the infrathyroid and the trachea. That is the common carotid. Case of healing and the repeat. The ATP regeneration creatine kinase synthesis occurs in which phase? That is the active phase. Which of the following tumor has the gene amplification? The neuroblastoma. The female chromosome abnormality is the 9:22. The person running the marathon race. Blood for the non-exercising muscle is by the postganglionic sympathetic cholinergic. Low dose epinephrine cause vasodilation by acting on the beta 2 receptors. The aged man presents with increased heart rate, increased cardiac output, decreased peripheral vascular resistance. Which of the following present pressure he's taking? That is the norepinephrine. Stab wound in the upper arm and the floor of the axilla. Which nerve is damaged most likely? That is the intercostobranchial nerve. The excess iodine is moved from the body through the urine. The characteristic feature of the acid fast mycobacterium tuberculosis bacteria is the thick walled mycolic acid. That regulation of GFR is by the tuberoglomerular mechanism. By considering the location of the pituitary gland, which nerve will be compressed by the tumor of the anterior pituitary? That is the optic nerve. The woman with the 5 weeks of pregnancy carries the German measles, single-celled obstetricians worrying about the baby. What is the most likely complication? The baby might develop the congenital cataract. The most important route for the antidote of the drug overdose is the IV. Gradual flux in the babies is present up to by the end of the 6th postnatal month. The cholangiocarcinoma is caused by the cholinergic sinuses. ADH short-term action is vasoconstriction of the arteriole. The patient has the infarct of the left ventricle, which is the subendocardial, and also infarcted intraventricular septum. Most likely, what is the cause? Thrombotic lumen of LCX. The patient the peptic ulcer disease ulcer gets rupture on the superior part of the posterior surface of the duodenum. The artery involved, the gastroduodenal artery, boxes it on the face. Temporomandibular joint damage. Now mouth remains in the open position. What muscle keeps in such a way? That is the lateral pterygoid. Which part of the following is the most potent antitoxin? That is definitely the glutathione. Next, 138, the aspirin, the low dose inhibit which of the following? That is methylthomoxanate. The heparin mechanism of action is through the inactivate the factor X. A lesion of the basic ganglia will result in the which muscular response? That is involuntary movements. Glycolic enzymes present in the RBC, the cytoplasm. The G protein possibly see increased intercellular concentration of the calcium ions. Increased calcium in the extracellular matrix will result in the systolic cardiac arrest. The ECG of the patient shows the progressive prolongation of ear interval in the excessive beats. The drawbeat beat. The patient is suffering from the Mobitz type Mobitz 1 AV block. Patient with pH number 3 by COP 16 comes at 38. What is the acid-base metabolic disorder? The metabolic acidosis. Female presented with a weakness on the right side. Posterior frontal parietal and the medial temporal lobe factor. Which artery is involved? That is the middle cerebral artery. Exercise causes the hypermodulation. What's the increased respiratory drive during the exercise? There is a central chemoreceptors. At third week of the gestation, mesoderm produces the smooth muscle in the capillaries in the villi. Type of villi is the tertiary villus. The lung is distended due to which of the following? There is intrathoracic pressure. The man during a roadside accident suffer injury in the cervical sympathetic chain of one side is cut. More likely the change in the eye is the ipsilateral pupil constriction. The ligament parts at the last during the epidural is the ligamentum flavum. The person present with the central chest pain for 3 hours, which cardiac enzyme will be raised? The CKMB. Patient with the nephrotic syndrome, which structure in the GBM plays which role in the pump selectivity for the proteins? That is the lamina rara externa. There is no edema with increased aldosterone because of the escape mechanism. L-DOPA is given for the Parkinson's disease. The following is from the anterior pituitary. That is the prolactin. The second polar body is formed in which of the following? There is a meiosis 2 during protein synthesis, where the following feature is seen. There is a cell has a prominent nuclei. Transmigration inflammatory cells by the help of the PKM. A man has a different blisters on the skin on the microscopy. Epidermis and dermis is separated by the thin flood. Which of the following type of the flood is present in these? That is the serous. Sterilization is done, which kills all except spores. Which the following organism can still produce the infection? There is a Clostridium tetani. The scientist is studying different cellular changes. He observed decreased cellular generation, the DNA damage in a case. Which of the following is the cause? There is the cellular aging. Next, the man after got fracture of the bone in RT and the plaster is done. After a few weeks, there is atrophy of the tissue. What's the reason? There is increased protein generation and decreased protein synthesis. Once sterilization done, which kills all excess spores, the following organism can still produce the infection. That is Clostridium tetani. Scientists in studying different cellular changes observe decreased cellular regeneration. The DNA change in the case of the following is the cause of cellular aging. Got fracture and RTA plaster is done after weeks and atrophy of the tissue. The reason would be the increased protein regeneration with the decreased protein synthesis. The afferent fibers of the ciliary ganglion is the oculomotor nerve. 17 ketosteroid increase in the adrenogenital syndrome. Increased potassium levels can cause the following. That is the flaccidity. Why can the complaint of the multiple bruising, ecchymosis in the skin and the recurrent epistaxis? BT and CT is normal. The thing like to check first of all. That is the platelet count. Patient has fair problem the breathing on the room. 100% oxygen given after with the mix. It goes to 670. Much oxygen 70 mmHg, which of the hypoxia is in. There's the VQ mismatch. The man working the cotton mill industry is prone to the byssinosis. The most common factor of the delayed wound healing is the infection. Next, which of the following is responsible for smooth muscle contraction of the intestine? There is a slow response contraction waves by the calcium influx. Got injury patient, which he lost sensation of the thumb, index, middle fingers with no loss of the thin or the palmar sensation, and the loss of the pincher grasp between the thumb and the index finger. The following muscle is paralyzed. The openness policies dicyclomine act on which receptor? That is the M3. The mother brought her a few months old baby. Child is the case of meningitis. She is worried that the two elder might got the infection. How will you tell that mode of infection, that is respiratory droplets? The patient with HB 15, oxygen content hemoglobin 20 ml, partial oxygen is 40, venous oxygen is 15. Which type of hypoxia is this? That is hypoxic. The time of birth, what will be seen in the child? There is the increased systemic vascular resistance in order to avoid the complication of the procedure that remains in limit of the professional competence. Which part of the intestine thick lobe with the less mesentery fat and the long vasa recta? How can surgeon ask about the bleeding according to the surgery? There is jejunum. Which layer involved in the esophageal varices? That is the submucosa. Which the following causes vitamin C, cervix, that is the HPV 16-18. Which muscle are involved in the forceful inspiration? The diaphragm and extensor-costal, SCM, serratus anterior and scalene muscles. The patient sustained injury in the RTA, patient the gait problem. Examination asked to stand up, right leg doing so the pelvis sinks. The following most probably damage, that is the right gluteus medius and the minimus. 182, the patient came the ER. The chest man ECG normal, cardiac enzymes normal. Doctor advised thoracic cage X-ray. Which of the following structure is the cartilaginous amphiarthros joint? That is the costochondral. Patient was taking glucocorticoid. Rapid withdrawal will cause the suppression of the adrenal cortical system. The young boy presents in the orthodontic OPD with the spacing of his teeth. In unsure of his age, following will help in estimating his age. That is definitely the multiple radiographs. The parasites are present in the small blood vessel. The female, the heart disease, downward traction of the airway valves cannot be made. Which structure is damaged? That is the chordae. The superior thyroid artery is the branch of which of the following are the external carotid artery? That's it. Thanks for watching my video. Do subscribe my channel. Next video.